Over the years, some men have made baldness their trademark and have proven that having no hair can be cool. But not everyone agrees. Australian medical student Zac is only in his early 20s, so losing his hair is not something he's thrilled about.
The hair is not really coarse here, it's just medium fine. But when you look back with the wet hair, you might hear turn around here. This is gonna progress because he's very young, the next 5, 10, 15, 20 years.
To have this sort of surgery in Australia is triple, quadruple the amount of money, and from what I can tell in Googling, I think Dr.Damkerng is probably better than most of the people in Australia, or all of them. I've been to Thailand a lot, and my aunties work here as well, so I trust the Thai people a lot, and yeah, I think I'm going to get the best of the surgery here.
Rather than search for options in his home country, Zac contacted the team at BODYLine Patient Care, who specialise in bringing patients from Australia to Thailand for a wide range of medical and cosmetic treatments. BODYLine's service is popular because patients have no waiting in line for specialists, lower costs, access to the best doctors, and can have a holiday while recuperating. BODYLine brought Zac here to the DHT Hair Clinic in the heart of Bangkok, whose founder Dr. Damkerng is regarded as one of the world's leaders in hair transplant and was a pioneer in bringing state-of-the-art hair restoration surgery to Thailand. You would never know he was once bald too.
What we usually do, number one, we examine the patient and we staging the patient that, what classification that he has. You can see the male pattern baldness starting from normal, and when you're getting all to stage 6, 7, it's completely bald. One, we diagnose this, and we're searching for the downy hair, and we think that he's a good candidate for hair transplantation. We will selecting the hair that is a permanent hair. If the patient have classic, the hair in the top part, usually the gene, the control, the top part, this is going to go as time goes by. If we have the gene baldness from the father side and the mother side. But when you see over 90% of the time, the men maintain like a horseshoe hair in the back, then what we obtain the donor hair from the back part.
So
what
you
we
take
call
the
the permanent
hair
hair on the back part.
And
you can see most men will be balding, and
yes,
from here up to almost the crown. So most of the doctor, we take the center. It is, we thought to be permanent hair. Okay.
And when you do a procedure like this, is it one time only, or does the patient need to come?
It's depend on how intensive the baldness is. If the patient have receding minimally, as in early male pattern baldness, like a class 3, class 4, many doctors can do it in one pass. But if you have intensive baldness, the balding area is too big, multiple sessions required.
And the time it takes to actually do that is quite a few hours, isn't it?
Yes, it is, depending on how many grafts we want to do. If we do 3,000 grafts, we take about 7 hours. We got 4,000 grafts, about 8, 9 hours. We got 5,000, it just keep increasing.
And very intense work for you.
Very intense work, we do one by one,
one hair
each
at
follicle. We don't call one hair, we call one follicle. Each follicle contains between 1, maybe 2, maybe 3, and once a while I got 4 or 5 hair. The majority be 2 hair graft.
And the patient will see the results sort of straight away?
No, we grafting, we don't use this long hair, we use this really short hair, because a few doctors in the world practice doing a long hair graft, because when you got a long hair graft, the patient able to see immediately saw how he looked when the hair started to grow. But if you got a long hair, it's easy for the hair to come out, during post-op care. Majority of the doctor, I think over 99% are doing a short hair graft. The hair continue to grow about 3-4 weeks and then start to shed. And the hair growing out again, about 4 months on average, more or less.
Yeah.
And to get the result, maybe 1.5 years, look the best.
Then it was time for Zac to decide on how much hair was to be transplanted from the back of his head to the top.
In terms of confidence, no. I feel generally pretty good about myself all the time. I guess I'm the only person in my family that has hair loss, and I used to have really good hair, and then all of a sudden I hit 20 and it just went away. I used to be that person who was like, oh, you have really cool hair, and then it died. And so for the last few years I've been sort of looking at different ways to do that, and I guess I'm 25 years old and I would like to think that I can stay looking younger as long as possible. Not that that's really a huge issue for me, but for the price you can pay in Thailand, it's definitely, I think, a smart option.
Dr. Damkerng says studies are underway around the world to clone hair, and one day baldness will be more easily corrected. But for now, you can recover your youthful scalp slowly but surely, one hair at a time.